Gastroesophageal reflux disease, or GERD, is a chronic condition where stomach contents reflux into the esophagus due to an incompetent lower esophageal sphincter. This reflux leads to bothersome symptoms and possible complications. The underlying causes include an incompetent LES, transient LES relaxations that become pathologic, delayed gastric emptying, hiatal hernia, impaired esophageal motility, and reduced salivation or mucosal defenses. Typical symptoms include heartburn, acid regurgitation, and non-cardiac chest pain, especially after meals or when lying down. Atypical symptoms include chronic cough, hoarseness, asthma flare-ups, dental erosion, a globus sensation, and recurrent sore throat. GERD can be diagnosed clinically based on symptoms and response to a proton pump inhibitor trial. Diagnostic tests include upper endoscopy, especially with alarm symptoms or inadequate response to treatment. Other tests include 24-hour pH monitoring with or without impedance, esophageal manometry, and barium swallow to assess anatomy. Untreated GERD may lead to complications like erosive esophagitis, Barrett's esophagus, esophageal strictures, adenocarcinoma, laryngopharyngeal reflux, and aspiration pneumonia. Initial treatment starts with lifestyle modifications. Patients should elevate the head of their bed, avoid lying down after meals, lose weight if overweight, quit smoking, and avoid trigger foods like alcohol, caffeine, chocolate, and spicy or fatty meals. Smaller, more frequent meals are also recommended. First-line medications are proton pump inhibitors, or PPIs, which reduce gastric acid production. Common PPIs include omeprazole, esomeprazole, lansoprazole, dexlansoprazole, pantoprazole, rabeprazole, and omeprazole with sodium bicarbonate. Doses typically range from 20 to 40 milligrams once daily, with twice-daily dosing for refractory symptoms. Vonoprazan, marketed as Voquezna, is a newer potassium-competitive acid blocker. It offers rapid, potent, and sustained acid suppression with fewer food timing restrictions. It's approved for GERD, erosive esophagitis, and H. pylori treatment when combined with antibiotics. Limitations include cost and limited long-term data. Other medications include H2 receptor antagonists like famotidine, which are less effective than PPIs but may be useful at night. Antacids offer fast but short-term relief. Alginates form a physical barrier against reflux. Prokinetics like metoclopramide are rarely used due to side effects. In cases of refractory GERD, confirm proper PPI timing and adherence. Patients may need a higher PPI dose or a switch to Vonoprazan. Impedance pH monitoring can help identify non-acid reflux. Neuromodulators may help if functional pain is suspected. Surgical and endoscopic treatments are options for select patients. Nissen fundoplication remains the gold standard and involves a 360-degree wrap of the stomach around the esophagus. Partial fundoplication may be better for patients with weak motility. The Lynx device uses magnetic augmentation of the LES. TIF, or transoral incisionless fundoplication, and Stretta, a radiofrequency treatment, are less invasive options. Barrett's esophagus is a complication of chronic GERD, where intestinal-type cells replace the esophageal lining. Risk factors include age over 50, male sex, Caucasian ethnicity, smoking, obesity, and long-standing GERD. Surveillance involves periodic endoscopy. Treatment includes high-dose PPIs or Vonoprazan, and endoscopic ablation for dysplasia. Special considerations apply to pregnancy and pediatric populations. In pregnancy, start with lifestyle changes, then antacids, H2 blockers, and PPIs if needed, with omeprazole preferred. In infants, GERD is often physiologic and rarely needs medication unless severe. Post-bariatric surgery patients may see worsening with sleeve gastrectomy and improvement with Roux-en-Y gastric bypass. Long-term PPI use may carry risks, though most are theoretical or based on observational data. These include deficiencies in vitamin B12, magnesium, and iron, as well as potential risks for fractures, kidney disease, infection, and dementia. If symptoms are controlled, step-down strategies include switching to H2 blockers or on-demand PPI use. Treatment of GERD includes lifestyle changes as a foundation, pharmacologic options like PPIs or Vonoprazan, and procedural interventions when needed. With proper management, most patients achieve lasting relief and avoid complications.